Without much ado, I would want to then bring to the fore the various people who are going to be on this platform, speaking to us, to our hearts the most. I shall start by the most important person on the next platform, and I do not care what the rest of the panelists think. This is what I think. The most important person on that panel shall be Jacqueline Tshuma, because there is nothing for the students without the students. Let's give a warm round of applause to the leadership. Next, I defer to Ms. Juliana Ruramai Mbofana. She's representing the Ministry of Higher and Tertiary Education, teachers, colleges, polytechnics, and she's principal of the Belvedere Technical Teachers College. I will defer at the moment to Mr. Amir Fouad, who is the Deputy Regional Director and Head of Domain for HIV and SRHR at the Embassy of Switzerland. You'll have to give him an even warmer round of applause if you want visas to Switzerland. Beautiful country, Switzerland, I am told. I am told. I think I waited last to introduce this gentleman because Mr. George Miti, he comes to us, he's the Dean of Students of the Africa University, but he's got another cap that he's wearing, representing Professor Munashe Furusa, who is the AU Vice-Chancellor and Chairman of the Zimbabwe University's Vice-Chancellors Association. I didn't know you guys still liked your Vice-Chancellors like this, but, well. Without further ado, I am going to ask the head of delegation, the head of panel, to make your demands known. Jacqueline, I want you to come here. I want you to unpack what we are discussing today, because we are talking about youth health, which is a development multiplier. We want you to unpack the theme, and we want you to make demands so that we know what you expect to hear from this panel and what you expect them to address, which by the end of this panel should have satisfied the zeal, the questions, the longings of the people that you're representing, the people that are in this room, and indeed the hundreds and thousands of students in this nation and beyond. Jacqueline, I defer to you.
Compliments of the day, ladies and gentlemen, once again, all protocol observed. So as the students, the first thing that when I was doing this research concerning the theme that says youth health, a development multiplier, I came across this quote that said, Mahatma Gandhi says, it is health that is real wealth, not gold and pieces of silver. So basically saying the most thing that is valuable to a human being is their health. Why are we saying so? Here we are all gathered here celebrating the National Students' Conference. We are all here because we are healthy enough to attend. We are all here to bring about the brilliant ideas that we can put forth because we are healthy to do so. So first of all, we can maybe get a preview of what is it that when we are saying you're a development multiplier. Youth health to me is a social factor that if increased or changed, it will contribute to an increase and a change in the national development. Now, why am I saying so? Youth health, basically, in its own explanation, it's a range of approaches that we're going to employ to prevent, treat, or as well detect young people's health and well-being. Now, national development, by its definition, you are referring to a constructive process of engaging all citizens and leaving none behind in building social cohesion, economic prosperity, political stability in a nation that is inclusive and democratic. Now, according to the statistics, youth contribute to 67.7% of the 13 million total Zimbabwean population. Now, if that is ignored, that basically means you have incapacitated a huge population or a power that that could have changed and led to a drastic change in the national development. Now, we understand that youth, they engage into risky behaviors when they are growing up. And this is the youth that is aged between 15 and 35. But just because you're engaged into the risky behavior due to exploration and experimentation, you need to be protected. And your youth health needs to be invested into. Now, why are we saying youth health is very important? First of all, when you are youth, that's when you can exercise your fullest potential. And these are the revolutionary thoughts that are capable of designing the world we are in. Now, what we understand is that when the youth health is compromised, we are raising a community that is incapacitated to build itself. And ladies and gentlemen, we are hindered from enjoying or fully practicing our dignified lifestyle and all our rights, educationally, politically, and most of all, the most important right of human life. So we are expecting that let every government provide the health services that we need. Let's expand and invest on youth health. Because without the investing on youth health, we are killing our own nation. Let policies be there to include youth in spaces of decision making. We expect that the panel will bring about the mechanisms they are employing to make sure that youth are part of these decision makers. It has been spoken about for long, but what are the measures that you're employing in this upcoming 2020 to make sure it's implemented on the ground and to make sure the youth health issues are catered for? Because the value of a country is known by its people. It is the intelligence and the work of a healthy people that really leads to progress of a nation. Thank you.
Short, precise, to the point, demanding. Another round of applause for what has been a great impact. We heard that, of course, if we do not invest in youth health and youth health is compromised, it leads to an incapacitation of the youth. That's a word we have grown to know quite a bit in this country, incapacitation. I will tell you, we are not incapacitated at the moment. We are beaming live all over the country and indeed all over the globe on Zimpaper's television network, where a lot of people are actually joining us and also making known their views. We've got Tandega Kabula. We've got King Chipara, who's watching in Durban and is following keenly. And we've got Rodney Samba saying the leadership here is amazing. So there we've also got an audience beyond this room. Going forward, I think I will. Goodness, I'm a sucker for the ladies. I'm going for another lady right now. Miss Juliana Ruramai Mbofana. You heard what the students are demanding. You heard what the students want. What do you have for them over and above this unpacking? But perhaps even before you go into your presentation, perhaps if I'm not putting you in the spot, could you also try to address what your understanding is of this theme, of the statement, youth health, a development multiplier? I defer to you.
Thank you, Robert. Yes, I want to say good afternoon. Is it afternoon? No. Good morning. Good morning to everyone. Yes, I agree with what our young lady here has put across. And my understanding of youth health, the development multiplier, is that without the youth, no development can happen anywhere. I'm here, of course, I'm representing the teachers' colleges, the polytechnics, the agricultural colleges, and the vocational training centers. I know these have an interest of the student at heart. This cluster has embraced the issues of the quality students' health as essential and of greatest importance to the total development of students. And what we are saying is without the student, those institutions would not be in existence. Students come to the institutions because they have an intended focus that hinges on their future existence, their achievement of specific goals, their success in life, and the development of our nation, Zimbabwe. Without the youth, we would not be in a position to develop Zimbabwe. So for this to happen, the students' health, as they proceed with their programs in these institutions, remains paramount. So that's why we are looking at them as the development multiplier. That's how we have to view these youngsters here. And in all that happens in government, in the institutions, let's put ahead the youths, because they are the ones who hold the economy. They are the ones who hold everything to do with our development as Zimbabwe. Now, going on to what I need to unpack to them, perhaps these things are not quite new to them. They are aware, especially in the teachers' colleges, in the polytechnics. They know exactly what is happening there, and that we are putting in every effort to ensure that these students have good health at the end of the day. So this cluster of institutions has, of course, embraced the centrality of students' health as a key pillar to the total development of students by, what have we done? The provision of healthy, balanced meals. Yes. I am pausing because I know recently, because of the economic situation, we've had issues here and there. But as institutions, we have tried to address that to our best. And we haven't done that alone. We've done it together with the students. So through consultations and discussions with the student representative councils, the students have been empowered to actually decide at the end of the day, what are they going to eat on a day-to-day basis, and ensuring that, that diet is balanced. And how they've done it is to come up with the meal plans. I know it is a contentious issue. They've done it to come up with a meal plan which, of course, is commensurate with the fees being paid. So at the end of the day, students have been fed. They've eaten, and they've survived throughout. They've managed to write their examinations, and there they are. They are proceeding with their education, which is a good thing for the country. We know what is happening there. Okay. And as institutions in that cluster, students get the opportunity to discuss their issues with the authorities, the principal and other authorities there, and they put across their views. We have an open door policy, which enables students to air their views freely, and that has been established in most of the institutions. I could hear, maybe it may not be happening in one or two, but what we are saying is there. We do have an open door policy. By establishment of the sexual harassment policy, we still need to be improved, because lots of ideas are coming from the students, which we need to include in the such cases of sexual harassment have been dealt with to the best of our ability. Yes, you let us know where we have to improve and ensure that, you get the best out of it. We have a pool of college counselors who have been identified, qualified or not, but we do have counselors. So students are also free to approach whoever, the staff member they feel comfortable with in terms of counseling. Most of the issues pertaining to the well-being of the students are dealt with during the health and life skills education, lectures, reproductive health education, which every student must do. Workshops are held, and students at the end of the day are exposed to the various requirements of their health, how they can go about addressing certain issues, who they can approach in order to, if you have a problem. So what remains really is for them to be able to embrace some of the ideas that are given. Tendency is for us to hide away. Someone has got an STI, they don't go to the clinic. someone has got this ailment, they don't utilize the facilities that are there. And yet, the facilities are at our disposal. So, what are we saying? We really need to be empowered as students and make use of those facilities that are available. As far as I know, all colleges have got a registered, well, a clinic registered. Maybe some have not been registered, but most colleges have got registered clinics. And what has happened recently, and I think it's emanating from your last conference, Jimmy, from the last conference where we advocated for, the Ministry of Health said we should have more qualified nurses in the institutions. And right now, as I speak, there were interviews for nurses. And besides the one nurse you might have heard at an institution, we are now going to have 2 nurses so that there is better attention for your health at the institutions. And in most institutions, we have the visiting doctor. And the interviews that have gone on, it was an attempt to get better qualified nurses at the institutions, where perhaps you might have had nurses who are not that qualified. So already, come January, the nurses are starting. They are getting, some of them already started working at the institutions. Most colleges have embraced the health assurance, the insurance schemes that students can use. I'm aware of the Save Life scheme, which students are using. They go straight to BMC and get treated. We have the first FMI, that's the first mutual insurance. Okay, so those are in place. Partners and MOUs with hospitals and clinics in localities have been created. Tunguza Hospital, Clay Bank in Gweru, the City Council hospitals, all those have been embraced in order to ensure that students get the health, the students' health is attended to. And of course, we have organizations such as the, say what? The FSN for sexual reproductive health and the workshops that go on. And when it comes to the maintenance of a clean and safe environment in the colleges, it means we have to work together. The colleges, college authorities, together with the students themselves, there's need for us to collaborate, to work together. What you put in is important. You cannot ignore the situation. To start off with, you are the ones who contribute to the some of the dirt. Some of you are the ones using the facilities all the time. So it's the way you use those facilities which determines what happens and how much has to be cleaned at the institute. So let's work together, really, the students and the authorities, in order to ensure that your health is looked after, is maintained with high standards. Clean working, learning, and teaching environment in the institutions will be ensured. Good waste management system will also help eradicate the litter, and perhaps the school bylaws regarding all the waste management and strict penalties for those would be required. Now, if we are looking at curriculum, which is provided in the institutions, I wanted to look at how these health and life skills education, the sexual reproductive health, what impact have they had on other educational performances? Have they contributed in any way to the other educational performances? What have they done to you as an individual with time? What have they done to your sporting life? I'm looking at you going through the health and life skills education, all those programs which you go through concerning your health. And I'm saying to myself, of course, for us to be able to feel the impact, I think some research is required as far as that is concerned. We haven't done enough research on the impact of that. This is an area which needs further research, especially in this cluster of teachers' colleges, polytechnics, the ITTDs. Although claims are abound that there has been significant effect on academic performance and performance in sports on these students who have embraced healthy lifestyles as espoused in the lessons obtained in health and in the health education lectures. But we know it is common knowledge that a healthy mind resides in a healthy body. And I suppose naturally we should be able to conclude that those lessons have had, the health education lessons have had some impact. So exposure to knowledge about health and life skills has high probability of improving performance in other areas. Health education programs can help students develop the knowledge, skills, attitudes, and behaviors needed to adopt healthy behaviors. And of course, research along those lines has been done. I'm citing Thomas Matingwina, 2018. Healthy students tend to perform better academically. That should be common sense, although the research was done and it proved that. The health education, risk behavior, and value for good health variables have a significant influence on the students' achievement in subjects. So the recommendation here is that health education should be mandatory for all students. And I'm sure we all agree to that. Now, what opportunities are there to strengthen the delivery of students' health? I know opportunities are abound. What we need to do as institution, there is need for us to increase engagement with other organizations, with other institutions that deal with health issues, such that there is open external support on health issues. We do need that. At times we are incapacitated along those lines. So if we get assistance from outside, then perhaps would be able to improve your situation, which you have been referring to, which you'd want to improve. We do need that assistance in one way or the other. But besides that, there are things which we can do on our own. And these things require even the input of the students themselves. I cannot tell you to go and exercise. The exercise regime that is not voluntary is the way to go. You should take it upon yourself that, I need to exercise to have my body, doing this and that so that I remain healthy. It's your responsibility to ensure that you use a condom. Nobody is going to tell you that. How responsible are we as students? Yes. A healthy mind resides in a healthy body, which comes through knowledge and skills that enhance wellness.
Ms. Mbofana,
yes, your 7 minutes are gone.
I'm incapacitated for time.
Oh, okay. All right. Just give me just 2 more minutes, perhaps, so that I wind up.
1.5.
Okay. Yes. I'm going to incapacitate you for a short while. All right. Support for those on the ART, especially with the prevailing challenges, is still needed. I'm also saying that support coming from the other students within the colleges is something we should do on a daily basis. You are aware that the other student next to you is not okay. What are you doing about it? Are you just laughing about it? And then you leave it like that. We have to take responsibility. My point is we need, besides us doing what we've been doing, it sounds obvious and it sounds as if there's nothing the colleges are doing. I'm not being defensive, but we are saying that we are trying our best to ensure that we improve on everything that we are doing in order to ensure that. And what I want to say, lastly, is that prevention before cure is what we need. It is also important that colleges recognize certain factors that might lead someone towards a worrying mental state or aggravate existing issues, ensuring that they intervene before this can develop further. So it is the responsibility of the institutions, the authorities in the institutions, to intervene before it gets worse. For example, initiatives must be put in place to help students in the transition into college life, such as the training of staff to recognize troubling behavior. I hope I have addressed, I had a number, but time is not on my side. I'll stop there. Thank you.
Thank you. Thank you very much, Ms. Mbofana. Indeed, time was not on your side. Jacqueline was on your side. Amir was on your side. Time was not. Just quickly from what I picked up from what you said, I'm not going to ask questions with regards to this. I'm going to ask you maybe a question or two, but I'm just going to tell you that you need to prepare yourself for especially the healthy balanced meals. We got quite a bit of a reaction there. You're saying you've got healthy balanced diets. You've got diets that are balanced. So they're going to come for you there. The sexual harassment policy, you did say to the best of our ability with regards to meals, you said you're feeding them to the best of your ability. Is your ability good enough? That's another thing that you will have to address. I'm sure it's coming for you. I'm just being nice here, telling you to watch out for what's coming for you. But basically what I'm probably just going to ask is, this is something that was asked from Gota. You did talk about the health and life skills that they currently that are currently enshrined in the current curriculum. But people are asking, do we not need perhaps an actual whole module on sexual reproductive health and rights as a strong standalone module? Because perhaps the current health and life skills are not really addressing everything that the students are interested in or would want to see being addressed. And this is, in short, like a minute or 30 seconds, if you will.
Thank you, Robert. It's a very good suggestion. It's a very good suggestion considering our pegged timetable. Yes. I don't think there's no harm in relooking and including whatever the students may want to be included in that. Okay, we'll work around and see how best we can do it. So that's not an issue, really. Yes, it's something just that needs to be brought forward, and then we look into it and craft something which will suit the needs. In fact, we do review the syllabus. Sorry? We do review the syllabus every now and again. So that will be part of the review to bring in what is current.
Thank you very much. And yesterday, when we did talk about that, there was also a time issue that was talked about and how packed things are. And my suggestion was basically just replace anything with mathematics, any module with mathematics, and then put the SRHR, and I think I would be happy myself. The next speaker is Mr. Amir Fouad. He is the Deputy Regional Director and Head of Domain for HIV and SRHR, as I said, with the Embassy of Switzerland. And again, I'm going to ask you first to try and unpack your understanding of what we're talking about, of youth health as a development multiplier, before, of course, you give us your perspective from your realm, from your domain, with regards the issue at hand today. I defer to you.
Thank you, Robert, and thank you to Say What for the invitation to be here. It's very inspiring to see a room full of so many young people dedicated to full realization of sexual health and SRHR. There's a lot of knowledge in this room, a lot of empowerment. You can see it, hear it, feel it. So I'm very happy to be here. There's still a lot of work to be done on these issues. I'm here to give a bit of a perspective from the development partner angle. And when it comes to development partners and the world of international development, our framework is the 2030 Agenda for Sustainable Development, the SDGs. And what makes the SDGs important, even if you think they're too ambitious or too unattainable or too idealistic or whatever, the important thing about them is that they are universal. It's not the North telling the South something. It's not the donor telling the government something. It is everyone's responsibility, governments, private sector, citizens, communities. So us here in this room is part of the 2030 Agenda and reaching that fulfillment. So we're very happy to see events like this and take part. You all know the statistics. We're living in a context where, as the executive director said, new infections of HIV are declining among adolescents too slowly. In this region, it's 70% of all the worldwide people living with adolescents living with HIV are in this region. On the one hand, still insufficient knowledge, incorrect knowledge about comprehensive sexuality education. You have insufficient use or incorrect use of condoms and contraceptives. Although after that poem, I don't think that's very much a problem in this room. I think everyone's using the condom correctly in this room. But don't forget, out there, it's still a big problem. And all the legal, structural, resource barriers that are still preventing new infections to take place. We're also living in a context where young men and women experience the SRHR challenges differently. We heard about that a bit this morning with the two groups: gender inequalities, gender-based violence, restricted social autonomy for women. But for men, you know, and I'm speaking as a former young man myself before I had gray hairs, young men also just have very bad health-seeking behavior, much less likely to even test for HIV. If they're HIV positive, less likely to get on treatment. If they're on treatment, less likely to stay on treatment. So a whole different slew of challenges depending on the context. We also see just a fundamental problem of access to age-appropriate services for SRHR. You know, if a health facility is seen as unwelcoming or judgmental in some way, the chances that you're going to go back and seek services are reduced significantly. I don't know how you're experiencing it in your campuses, but it just takes one bad visit. I don't feel welcome here. I feel like I'm being judged, and then you're just going to stop, and then that's already a big disruption in the provision of good care. In other contexts, in terms of access, you have policies in place. You need parental consent, and so you need parental consent. You're not going to go. Or maybe you're not going to go to the clinic because you know that they all know your aunties or your uncles, and they're going to tell your family that you went there. So we're seeing from the development, from our perspective, just these challenges that are very difficult to overcome. For us, this is a regional issue. Negative health outcomes, spread of HIV, gender-based violence, these things don't care about international boundaries. They are widespread, not in Zimbabwe, but in this region. So even if we were to solve every problem in one country, what's happening in the neighboring countries affects us here, and vice versa. And that's a very real consideration that we, as Switzerland, take. We are financing a regional HIV SRHR program. We want to introduce policies that that can then be taken up amongst all the countries of the region and then implemented individually. So that means testing things locally, using those examples of what works locally to try to convince people, the governments who meet regionally, SADC level, the Southern African Development Community, to come up with some shared understanding of what works. friendly. I spoke about it before, but if you have a single nurse in a clinic who is educated on issues of young people and sensitized to that, is it enough? Because before the patient or the person even gets to that nurse, they may have to go through a security guard or a receptionist or somebody who is judgmental. So actually, it needs to be the whole system that is youth-friendly and young person-friendly. Oftentimes, a single nurse isn't enough. We are trying to, at local level, influence social norms change. So you can work with the village chiefs, with communities who have rites of passage ceremonies, and try to make sure that factual information about SRHR is getting across. And if we have examples of where that's worked in one country, we can then show those examples to leaders from another country. And then, of course, social media outreach to get across some of those barriers of parental consent and judgmental service providers. If you can provide information over social media platforms, that's very helpful. You may be skeptical about the ability of regional initiatives, but at the SADC level, there has been some interesting progress. You have the governments of Southern Africa who have come up with a model law on, for example, eliminating child marriage, and now you also have the governments of Southern Africa coming up with a common sexual and reproductive health and rights strategy, which is actually quite progressive. So now it's just a matter of getting those states to take those things that have been agreed at regional level and implementing them at home. And there is some movement, on child marriage. In Malawi, we've seen some debate on possibly removing the chieftainship of a local chief who allows child marriages to happen. Here in Zimbabwe, you have the possibility of a mandatory minimum sentence for perpetrators of child marriage being discussed actively. You have the issue of, consent. If a 17-year-old and a 15-year-old have sex and they're in love, it's not very productive to a society to send that 17-year-old boy to jail for 10 years and treat it as if it's a 35-year-old who was slept with a 15-year-old. So we've been talking about that at regional level, and a few countries, Botswana, South Africa, have actually instituted laws to prevent something like that. So these are the approaches that we as Switzerland are trying to take at a regional level. And I'll finish off by saying that in the future, there's two sort of things that are priorities for us. One is to make sure that these issues stay on the radar of people in power. I mean, right now, when it comes to health, there's this topic of universal health coverage and how a country provides health services to all its citizens. But SRHR specifically tends to get lost in that discussion. So we want to be the ones who are always knocking on the door and say, don't forget about SRHR, don't forget about HIV prevention. And lastly, social accountability in health programs. It's important that in communities, wherever decisions are made on health matters, that people living with HIV are involved in the decision making, that women, that young people are involved in decision making, or if they're not involved, at least have a way to hold the decision makers to account. So we're very interested in exploring opportunities to do that.
Thank you, Amir. A warm round of applause for his contribution. I will not ask a question because we're very frugal on time right now. But what I did pick was very important, the fact that there's no Noah's Ark that protects one community from the next. So a regional approach is something that is absolutely, absolutely important. And you are coming here today different, aren't you? Mr. George Miti is coming as the representative for and on behalf of Professor Mnashe Furusa, who is the AU Vice-Chancellor and Chairman of the Zimbabwe University's Vice-Chancellors Association. And Vice-Chancellors tend to talk a lot. You're not. You're going to give me 4 minutes or 3 because we want the stakeholders to at least have a say really quickly before we round off this very important talk. I'll defer to you.
Thank you very much, Rob. I hope I'll make my presentation much shorter than 4 minutes. I If you fail to understand everything that I'm trying to say, the basic message that I'm giving you is, as youths, show up. You can just scribble on a paper the 2 words, show up, because that's what we battle with in higher education. The mandate for higher and tertiary education has been expounded by the previous presenter. Basically, we can summarize it as creating and being custodians of knowledge. Of course, we can unpack it and look at it even through the higher education 5.0 or universities 5.0 lens. And I want you to go and look it up. Look at what University 5.0 means. And as students, understand it and say, where should we show up as students? Creating knowledge, the approach is co-creating knowledge. So it's the student and the professor creating knowledge together. And this calls for participation by the student. That's why I'm saying you should show up. And you can Google, if you now have Wi-Fi, you can Google on your phone or on your iPad or any other gadget the ladder of participation. I'm sure some of you know about it already. So I'm not going to teach you about that because we co-create knowledge. So if you look at it now in your phone, you will see the ladder of participation. See where you are as youths and move to the higher rungs of that ladder. So still the message is what? Show up. In answer to your question that you chose not to ask me, but you asked the rest of the panelists, I will want to persuade you to assist me develop a model of what higher education tries to do to get students to the level of development that they wish, and society to the level of development that it wishes or aspires. My conception of development goes beyond the economic well-being, the economic development. When you have the money, then what do you do with it? What you do with the money or with the wealth is what brings the human development. So the ultimate aim in my book is human development. So I will want you to take a piece of paper and from halfway through, okay, back to class, eh? Yes, let's have some participation. From the middle of your paper, I want you to draw 4 circles going to the right end of your paper. So just draw 4 circles of any size. You can leave a bit of spaces between the circles. Now, students are known to do things swiftly. I'm sure you are done with the drawing. Don't worry about making it a perfect circle. Right. In the circle at the extreme right, you can write human development. Don't worry if the words don't fit in the circle. You know they are in there. Human development. In the second circle from your right, you can write the words economic well-being, economic well-being, or economic wealth, whichever you want. In the third circle from your right, you write the words student success. And of course, the last circle is the first circle from your left, isn't it? Yes. You write health or student health. Okay. So basically what we're saying is student health leads to student success. And this is, so you can put an arrow there. This is basically what our student affairs divisions are geared to achieve. To assist you through whatever processes you are going through, be it in class, out of class, in res, out of res, in sport, and so on, to assist you to achieve student success. And the measures of student success are multiple. They can range from passing a test, an in-class, passing an exam, getting a good grade at the end of the semester, graduating with a good degree classification, proceeding to the higher levels of education, and success in life, which is perhaps the ultimate. Then we think that that success is what will bring economic wealth or well-being. And then you can translate your economic well-being into human development. So that's, in short, the kind of nexus that we see between student health, economic development, and what higher education is trying to do. So where I'm saying show up, I'm saying all those elements that feed into student health. And in your universities or colleges, you'll find there is sport, there is counseling, which is good for your mental health and psychosocial support. There is food, which she has aptly talked about. There is academic success. There is accommodation, which you guys were battling with. There is student development. And all those things, you have to show up so that you benefit from them. Let me end by saying that the window that is there between students, you, and university administrators is very blurred. It's not very clear. It's not easy to see through it. So you guys as peer educators, we want you to assist us to clean it from both ends. Because you interact closely with us as administrators, you also interact with students. The needs for students are a moving target. It's very difficult to pin down and say students need this, therefore we're going to provide it. Once you provide that, it has shifted. So we're saying you help us to clean it so that we have an idea of what students need, and students also have an idea of what university administrators are trying to do. Because I can assure you, when vice-chancellors meet, when deans of students meet, and I have several of my colleagues here, I know we have dean of students from GZU, from Bindura, from Chinoi, from... yes, they are all here, HIT. So I know when they meet, they are worried about the same things that you are worried about. Where are our students living? And you are also saying, where are our dean of students when we are living here? So let's clean that window so that we see things from the same perspective. Thank you.
Thank you very much. I'm trusted teacher to always be a teacher. Look it up. It's left you with homework. Google it. But I will say, not with any stereotypical intentions, this is directed to the female students. I need a bit of help. Somewhere, as he was speaking, I tried to give him Zisora Maire. It obviously didn't work because he kept talking. It was meant to say, stop, so you should teach me how to give him that eye. That eye. However, we are quickly going to wrap this up because some of our panelists have got other engagements towards which their attention is needed. However, just to wrap this up, we're going to open the floor up to one question from the ladies, one question from the gentlemen, and one question from these people who are looking very sad and lost. You're also loved. Yes. So, the gentleman in the spectacles isn't asking today. Oh, okay. So is the gentleman in the spectacles. Please, could I have a question, not a two-part question like Mr. Miti tried to teach people yesterday? No, I have a question, you ask a question. And then in the interest, of course, of time. The lady over there.
Okay, thank you. I have an issue.
Your name, please, and your institution.
All right,
Oh,
I'm Kim
that's
from
the master's
UZ.
lady.
Kim from UZ.
Okay.
I have a question on the issue of meals. I'm not quite sure about the balanced diet that you alluded to. We may need clarity, or let's be on the same page of what we understand about balanced diet. Because from what I recall, students, we actually struggling to get proper food in the universities, because like the semester marriages that have been talked about, this is also a challenge, because people want good food and they have to source it outside, and it's expensive. So it's causing a lot of problems. We see people queuing outside the gates to get good food. So I'm not quite sure about the food issue. There is a lot of, it's a gray area for us. I don't think we are getting good food. There is no good food in the college.
Okay. No, that's another two-part question. So we get you there.
Student loans.
We will, don't worry, I'll give you a loan after this. Can't believe it. And then the gentleman in the spectacles who always has to ask a question. No, over there. No, he knows himself. Take your spectacles there, behind. That one. Yes, that one. I'm sorry.
Okay, thank you very much for the opportunity, but then my questions are too much, so I'm leaving my guy who has only one question.
He wanted to know about food. Okay, fine.
Okay, thank you. My name is Gifty Spanda from MSU. There's one thing I would like to ask. Maybe I'll also be speaking to the question that was posed by the executive director for Say What. We have been pumping, and what the panel has also alluded to, I think there's a connection. So much money and financial resources have been invested into trying to change or to counter sexual harassment challenges and problems. But the change is not that noticeable. The reason why I think this is happening is, do you ever wonder whenever we plan awareness campaigns? Maybe it's a alcohol and substance abuse campaign, and you're the one who's planning it as the president, maybe for Peer Educators Network. Who is your target audience? You realize most of the time the people who attend most of these campaigns are your friends. They come because they want to support you. But the real people that are affected don't come. So I think what we need to do is to change and try to find more creative ways of engaging young men. Because you realize that we are gathered here, maybe someone is representing peer educators, someone is representing that organization or institution. But the real people that are mostly affected by these things are the people that never attend these things. We plan debates. They're not interested in debates. They're not interested in quiz. These are people maybe who will be staying, for example, if it's in Gweru, it's a Neo show. They would not come, they just attend lectures. As soon as they're done with lectures, they go back home. They may even finish the whole 4 years without even knowing the gene of students. So I'm saying, let's find more creative ways of engaging young people. One thing I'd like to say is, Jean, can I have one president from any peer educators network, from any institution? And I would ask them, do you know the sexual harassment policy from an institution? Maybe they don't. But we're right here talking about sexual harassment and reproductive rights. So I'm saying, there is a gap between student affairs and the students. And that gap, we have the SRC in between. But you realize whenever the SRC, I'm giving this because I had a year serving as the SRC president for MSU, and I'll tell you that the activities that the students want to come and be a part of, I know these formal gatherings. They won't come, maybe they will come for the food. They will not listen. But you tell them there is a dance or there is a gig, you see them in their numbers. So example, what we did at MSU when we had a campaign, mental health and awareness.
You do know you are eating into my time.
Yeah, so I just want to give this example. We tried to invite the students that are abusing this substance, because we had about 8 kids who died due to suicide. And you'd realize that the student affairs didn't even know the students. But we'd go attending the funeral and be like, we knew him. He was a very good student. Lying in front of the... So one thing I'd like to say is what we did, we tried to invite someone who's influential. Someone they can even look up to. Someone like Soldier Love. Can you please at least come, but come sober? So that the students we need that are abusing these substances, the moment they hear Soldier Love is coming, they will definitely attend. So the moment they attend, we use that platform to engage them. Let's organize things like maybe soccer matches. We try to call those gateway youth. And then out of those platforms, we try to engage them. So I'm saying let's move away from the formal gatherings.
Okay, thank you. Thank you to the room.
A lot of questions, but because of our time.
And that's to you, Amir. You were talking about that yesterday, and you were asking that question. And you were also, I think that also speaks to what you said, show up. Come to us, let's talk about ways of changing, and for want of a better word, sexing up our campaigns and programs to ensure that people are actually interested in them and that they actually have an impact. Do we have a question from my right? I'll take that as a comment and also as a contribution to what you also wanted to get. If there's no question from, oh, there is. I'll take a question from the lady. Okay, you know what? I'll take a question from anyone.
I just want to find out from students, when you go back to your institutions, what are you going to do with your blessers? Because I understand you've got blessers, especially ladies. Thank you.
Okay, very important question. She wants to know the fate of the blessers after this conference. What is there? And I'm pretty sure even the blessers want to know their state as well. Okay, so that's very interesting. It's coming back to you. But pretty quickly, I think the question that we first got on meals, I think it was also a test, because what is your understanding of a balanced diet seems to be a test. What is a balanced diet? It's like you're writing a test yourself. So what is your understanding of a balanced diet? Because the students believe they are very, very far away from balanced diets. And perhaps real quick, because we really are 3 minutes beyond our time.
My understanding of a balanced diet is that you have a bit of the vegetable, the protein, the veg, the starch. Okay. Perhaps, well, I'm looking at carbohydrates, protein. Okay. And then you need to get some minerals from the vegetables and all that. That's my understanding of a balanced diet. You get from all that. And if you go on and have beans and sadza, beans has lots of protein. And sadza is the carbohydrate part you're getting. Then you also have afterwards your water and all that. Then, and a lot determines what we are going to get at the end. I understand where you're coming from. But when you go out to look for food from those vendors and leaving the food in the dining hall, I know you are saying something. You are actually saying something about what is being cooked in the DH. But what we need to do then, as has been alluded to by Mr. Miti, Dr. Miti, yes, Mr. Miti, show up. We need to work together. We need to work collaboratively.
Thank you.
And see how best, what meals we can come up with, how we can go about it, making use of the resources available. Because what determines in most cases are the resources which are available. Without the money to buy the meat which you would want at every meal, what do? We have to serve you with what we have, what is affordable at that time.
Thank you, Ms. Mbofana. And as you hand over to Mr. Miti, I would like one of the students, perhaps the ladies, to answer the very contentious question that we all want to know. What happens to the blessers? What is the... Oh, yeah. What happens to your blesser? Give her a mic. No, she's the one with the blesser, yes.
Okay, okay. Before she answers that, let me add on to the food thing. The way I see it is the way we resolve the food issues at home should be the same way we resolve food issues at our institutions, because we are operating in exactly the same macroeconomic environment. Thank you.
Spoken like a father. Can I have your name and your contribution? No, you do not have a bliss. That's a disclaimer. Just
fine. Thank you. I'm Miriam Tembo from Morgan College. Thank you for this platform. We've benefited a lot. But on our blessers, our issue comes back to when you come to colleges and universities, we have our issues. Our coming to learn is not because we are comfortable, but we are struggling. But we want to come out of we want to change our situation. We want to come out of poverty because maybe no one has gone to school in my tribe. They don't understand that I need to do my projects. I need money. And at the end of the day, who comes to help you? Hey, and the way he's helping me, he's even pulling me from the school. But now, that's not the point. What I want to run to is our lecturers, our admin, as our mother was saying, that we need health and life to fit with our situations. We're just having health and life in our lectures, but with my lecturers and my admin, we cannot talk. I have an incident where one of our students, she was coming to school. She went for TP. She was about to finish. We are in our last term. She went back to her school. She was being abused by the husband. Friday, she was at school. Saturday, she committed suicide. She had no one to talk to. She died. She was supposed to be graduating with us, but we no longer have one because she was being abused by the husband. She was being beaten. The husband was having boyfriends. But when she comes to school, she had no one. Girlfriends.
It's fine. It's Human Rights Day. It's fine.
Sorry. She had no one. If we create this window that is blurred, if we clean it, and I get to school, I'm free to talk to my dean. Ma'am, things are not good. I'm hurting inside. I mustn't be beaten for 5 years and struggle for 3 years in my college. And I have no one to share with. We need to open this up. We are open here, we can talk freely. But at school, we don't have these platforms. Let's open at our university, at our colleges. Open up. Let them speak. They are running away from the poverty from home. And the husbands that are they're even angry. They don't want us to get the graduate, the certificates, the diplomas, the degrees. So now, open up in our admin. Take us in. If you see me complaining, talk to me nicely. What's wrong, my girl? Hey, you don't look good today. Don't just say my assignments, my projects. Hey, you're not. No. Talk to me.
Thank you.
Get me close.
Thank you.
Thank you.
Thank you so much for your contribution.